Hi and welcome. My name is Dr. John Noble. Welcome to the Village Chiropractic Clinic. Today is the first of a series of posts we're going to do over the next few months on very specific health conditions. Today's post happens to be about posture. When you come to a chiropractor, the very first thing that chiropractor should do upon examination is look at your posture. We usually look from the head to the toes. Patients from time to time complain of very specific signs and symptoms in the foot. Could be pain, could be swelling, loss of arch support, and the foot can affect various different conditions, various joints of the body, including the ankles, the knees, the hips, eventually the spine and neck. So our feet are very complex, consisting of about 26 bones, 33 joints, and about 100 muscles, tendons, and ligaments. The foot also consists of two really important arches. One's called a long arch or a longitudinal arch, and that's the one that runs up and down your foot. The second most important arch is called a transverse arch, and it runs across your foot in the other direction, perpendicular. The types of conditions that patients usually complain of when they come to the clinic would be things like Achilles tendonitis, iliotibial band syndrome, metatarsalgia, plantar fasciitis, runner's knee, and sacroiliac syndrome. Many of these conditions are caused by improper posture of the foot or foot dysfunction. Posture being very important, we look from the feet up, making sure that your feet have good posture, knees, hips, shoulders, and eventually to the neck and head. The spine, of course, being in the middle, but your feet are supporting your posture from the very bottom. So the most important condition we want to talk about today is a condition called pes planus. And what that means is flat-footedness. Very, very common in the population, especially with the patients that we see. And usually most of the population is flat-footed. We also call this pronation. There are two conditions, pronation and supination. Supination being very, very rare, sometimes in runners, but pronation almost 80 to 90% of the population. How our feet get flat, various different ways our feet can get flat. Could be a family history. We see some connection between a parent and a child. Obviously your postures are similar, your genetics are similar. So there is a chance that you could inherit your father or your mother's feet if they have problems with their feet being flat-footed or pronated. You might end up with the same. Second is a weak arch. Over time our arches and the muscles in the bottom of our foot can weaken, which causes the arch to fall. Second could be running. Many runners have difficulty and problems with their feet because of the stresses that they're putting their feet under day to day. Pregnancy could be another condition where ladies' feet definitely become flat, pronated, and they splay or flatten out during the pregnancy because of the extra weight that they carry. Diabetes is another condition, and more importantly, just wear and tear and age. So as our population ages, as we age, again, our arches fall, and this is usually has some devastating effect down the road with the way our feet and the different joints connected to it behave. So the condition pes planus, very important again in clinics like ourselves. When we examine people's posture, we look from the bottom up. Usually pes planus is a non-painful condition unless you're unlucky enough to have had problems with your feet in the past. But most patients don't understand that just because their feet don't hurt them doesn't necessarily mean they need to have them corrected. Same situation or same analogy as the spine. So we like to be very preventative about someone's foot posture because we know in the future eventually it's going to cause them symptoms down the road. The fix usually for pes planus or flat-footedness is the use of an orthotic. And how an orthotic works is the biomechanics of your feet being abnormal. The orthotic gets put into a shoe or a boot for that matter, moved from shoe to shoe, and as you walk over the orthotic, causes your biomechanics in your foot to become normalized. When we walk normally in bare feet, if we're flat-footed, usually our heel strike, the way our heels strike the floor, is improper, our mid-stance is improper, where our arches are falling and letting us down, and eventually the final phase of gait being toe off is usually improper as well. So when we insert an orthotic in someone's shoe or boot, it helps the foot become very biomechanically neutral or normal, and then the patient is down the road is able to walk in more of a normal gait situation. Many different ages of people wear orthotics, all the way from children right up to people that are geriatric in age. So we see patients from a wide variety of ages that require some foot correction. Many types of orthotics are available to us as well. Usually we're using them in a running shoe or a work shoe, a casual shoe. They can be fitted to a dress shoe, for instance. We have orthotics that are available for patients that have diabetic feet, who are sensitive to ulcers and very sensitive feet in the bottom. We have orthotics that fit into skates, into snow boots. So there's many different applications of orthotics that we can use. Often we'll instruct patients to wear their shoes and their orthotics indoors rather than being barefooted. Being barefooted, you go right back to your old bad, improper posture. So we like to have patients in their orthotics and in their shoes, especially on tile floors or hardwood floors at home. As an alternative, we can fit a patient with a sandal or a clog, which has a very specific prescription for that particular patient. Those can also be worn indoors, obviously outside in the summertime. So an interesting part of practice is that patients often come in trying to correct their own problems. And that's fine. There's definitely many different types of retail products out there that you can buy. There's Dr. Scholl's, various types of things you can purchase in Shoppers Drug Mart. This is one example of something that a patient brought into me. These orthotics are very, very flexible. They have a bit of a gel coat on the bottom of them. They're for comfort, really. They're not going to make much correction to a foot that has some improper biomechanics. So these can be used temporarily, but in a long-term fix, really a patient should be fitted very specifically for their foot and the proper postings and proper correction made on the orthotic for their individual case. As you can see in front of me, there's various kinds of orthotics that are available to us, as I mentioned earlier. This one obviously for children, and as we go across, more of a thinner type of orthotic, a dress orthotic for someone with a very slim fitting shoe, particularly women. Most commonly used, this orthotic will fit a dress shoe, perhaps a casual shoe, and then a running shoe. And then as we go across again, this is more of a runner's orthotic where we have extra support and foam cushioning for the heel for the runner's strike as they run different pressures, obviously running on hard surfaces. Finally, the very last one is diabetic orthotic, which is very soft on the top, and we'll often use that application with seniors who have very sensitive feet. Not a lot of correction in a senior, more just for comfort. As a younger individual, we would go for a lot of correction, try to correct the foot properly, and usually they can withstand that correction versus a senior patient. So the process that we would go through in order to see whether you're a candidate for orthotics or if you are in fact, what we do in the clinic is book some time to evaluate your posture, evaluate your biomechanics of your foot, and usually get you on the computer where we use a very specific program called a GaitScan, which has a pad that patients can walk across and gives us very specific information about how their foot is contacting the floor. We often use a foam cast as well. Different companies use that particular application, and we can fit your foot into the foam cast. Gives us a very exact replica of how your foot looks underneath, and we use that also to send to our manufacturer to have the orthotic made. One thing in passing that I would like to point out is that although we can fit you with a great orthotic, which is again very specific for your foot or your condition, they must be worn in good shoes. And if you're wearing shoes that are old and broken down, usually the correction is lost. So we often advise our patients to buy a new pair of shoes along with the orthotic at the same time, and that way they're in good standing with full correction. So in closing, I'd like to thank you for your time. It's a very exciting time for us, able to present different conditions, things that you'll learn from us online or on the videos. Hopefully you'll be able to apply those to your family and friends. Stay tuned for more information, more conditions that are very common. We'll be presenting those in the next few coming months. But more importantly, take care of your family and friends and in good health. Thank you very much.